Good afternoon and welcome to this workshop. I am Professor Donahue. I am a professor of global health and healthcare administration at the University of Maryland, Baltimore. And I also have the privilege and the honor of serving on the board of directors of the World Association for Disaster and Emergency Medicine. Today we will be talking about climate change and the songwriter Bob Dylan famously wrote, "The times they are a-changing." I am shamelessly stealing from Mr. Dylan to point out that the tides are changing, and climate change and health disaster issues truly matter to all of us. First, the standard disclosure: I have no relevant financial relationships, commercial interest, nor do I benefit from presenting in this wonderful session. So, defining climate change. I mean, clearly the world knows about climate change, the famous Paris Accords, but there's less of an understanding of what that means. Climate is the prevailing weather conditions in general over a long period, but that also involves other aspects of the environment. The term Anthropocene, which considers that for the first time in history, humans are impacting the world's climate and the globe. The things we do are changing the world we live in. An example there is several years ago in the United States, there was massive flooding in Texas, in Houston. The reason there was flooding in Texas is because there was no building code. And people built and built, paving, putting in parking lots, taking out natural barriers that absorbed rain. So when an unusually large rainstorm came along, there was no place to go, and the entire region became a giant pool. And then the other aspect of that is the concept of disaster risk reduction. If we look at it, we realize that there aren't any natural disasters. There are natural hazards. The disaster happens when mankind interacts with nature. So disaster risk reduction, another word for that is building resilience. The ancients had the goddess of the earth, and there's the earth has always impacted humans. Some key international issues here: the huge tsunami in Banda Aceh, massive typhoons in the Philippines, earthquake in Nepal, tornadoes in Oklahoma in the United States. Nature has always affected mankind through all of history. Lately, over the last decades, nature has become more active. This is a little dated, but when we once had a number of storms, a number of natural disasters, that number has risen tremendously, and climate change has been at the root of much of it. It's not the Earth's temperature has changed. It changes our weather patterns. It changes the temperature of the ocean. And there's so many other things that impact, as we will discuss momentarily. So there's obvious evidence. The sea is rising. There's visible and dramatic testimony of this. But these floods, what you're seeing here, these floods were not caused by a rising sea. This is not the coastal community where water inundated the land. The floods have been due, obviously, to climate change, overbuilding, deforestation, and much like in Houston, marshland infringement. Humans have expanded our footprint, and we've impacted the world, and the world in turn impacts us. And that's everywhere. This is from several years ago. The French deadly floods, as the headline says, along the Riviera, with people experiencing death. Historic issues. And is the aftermath of the flood, something that rarely gets much attention. We cover the flood, we cover the impact on people, and then the media, the news media, and social media goes away. The impact can be significant. It can change the environment and bring pollution. It can bring structural damage. vermin, mice, snakes, insects come out of nowhere, and mold. Mold is, mold evolves after the moisture goes away. You can see on the right next to the word, you see the black growth with spores that are dangerous to people. We have land and mudslides when secondary to deforestation, the fires, overgrazing, or poor agricultural management. When we take away the natural flora or even the industrial flora that keeps the ground stable, the ground becomes unstable and can impact people. So there's actual intrusion by humans continues to impact the world. One of the issues that's gotten a lot of press over the last couple of years because of the significance and the breadth of it is wildfires. As you can see, wildfires are on every continent except for Antarctica. Last year's my Australian colleagues are still suffering the impact of the massive wildfires they had there in the western United States. Entire communities and neighborhoods have disappeared. These are caused natural. It's nature's way of cleaning out forests through lightning and other things. Human impact. Humans cause fires. Humans, camping or careless disposal of cigarettes or other materials. Sometimes there was a fire in the United States last year. It's caused by a faulty muffler on a vehicle. And then proximity of structures. When we build houses or factories next to trees, next to forests, next to underbrush. When the underbrush burns, the buildings burn as well. The part of what's impacted the Earth's climate is deforestation. Over a little more than 10 years, almost 228,000 square kilometers of forest were taken away from the Earth. This does a couple of things. We lose the ability of the trees to replenish oxygen, to take carbon dioxide out of the atmosphere. It disrupts ecosystems. It dislocates animals. It dislocates microbes. It changes how plants grow. It has a huge impact, which we'll talk about shortly. We've seen hotter summers. In 2019, the temperatures were really high across Europe and across much of the United States and the rest of the world. This generates heat injuries, poor air quality, increased allergens. People have more respiratory distress. It creates cardiovascular complications. And the extreme excessive heat has a huge impact on society, on operations, and on healthcare. Yet, the more things change, the more they stay the same. Great image from Holbein from the plague of 1538, showing how that time they looked at death rampaging across Europe. Every microbe migrates with the encouragement of human trade and travel. And again, bouncing back and forth, SARS, and amazing. This picture I find striking. An emergency department closed because of SARS in 2003 in Toronto. And it's an interesting sidebar that Holbein, despite depicting the pestilence of the plague, died of the plague scant years after this etching was created. So microbes become refugees from war, trade, travel, urbanization, and poverty. They as we impact the world around us, germs move around, and they move around, and we become reservoirs for their spread, for their continued evolution and their continued survival. I mean, that's clearly been seen over the last 14 months with COVID-19. So microbes travel to new environments, and we build on old habitats and old ecologies. When we build buildings and expand cities. We dig into nature and we dig into what's there. Now, granted, these areas, Doha and Sao Paulo, are far away from where we are, but that the distance does not save us, which I'll talk about momentarily. There are distressed populations, dense settlements with poor or no sanitation, minimal health care, untreated water systems. These are petri dishes for microbial diffusion and the availability of the insects and animals that will carry these diseases into the human population. These stress in human habitats make it, they make a perfect storm for spreading disease, and spreading disease and carrying illness across the humanity through deforestation, because of refugees, and because of poverty. But we may stop and say, but this is France. We don't have this problem. You look at Africa and Haiti, Mexico, and even the reservations in the United States. But we do have this problem. There are small sectors of people living close together in unsanitary and unoptimal conditions that create a danger right in our own backyard. But these dangers also exist around the world. I focused on this slide in areas that have floods. There's the subcontinent of Asia, India and Pakistan and Bangladesh, Southeast Asia and Sub-Saharan Africa. All of these are areas where diseases, tropical diseases, can emerge and can evolve and can travel around the world in a hurry. There are multiple disease spreads. We have infectious diseases that existed in one spot of the world that now exist almost globally, or many other areas. Hanta, West Nile, Ebola, and Zika are example. Every year we face a new strain of influenza, the annual flu season. And we have novel diseases. I listed a couple of them here: Legionnaires, Lyme, SARS, MERS, and COVID-19. Brand new diseases that never existed. The quote there is from the 2007 World Health Report. And in 2007, the World Health Organization reported that there's more than one new disease emerging every year. And that, a generation, the quote there are at least now 40 diseases that were unknown a generation ago. This is accelerated, and we see it now with the spread of COVID-19 and the specter of variants. Nature moves faster than humans can move sometimes. This is complicated by rapid global travel and antimicrobial resistance. Part of it lies in our industry. Tires and a lucky tree. These are both products that come from the Far East. What do these products have in common? They have in common the Asian tiger mosquito. Both the plant and the tires capture water. Water is the breeding ground for mosquitoes. So here in North America, the Aedes albopictus is now present here, where it was a East Asian source. It's now here, brought here by commerce. And so globalization is, with commerce, trade, labor migration, has been happening for centuries, and it's been destroying ecologies and bringing disease with it. Everything, travel, trade, and war have accelerated, but the things that have happened in the past, the way we've transported microbes around the globe, has been for eons, as long as humans have been traveling. What's changed, though, is the speed in which we did it. The word quarantine comes from the Italian for 40. A ship would enter a port and it would sit at anchor for 40 days till the people in the port on land were assured that the sailors didn't carry a disease. Now we move around the world quickly. You can be in South Africa this morning, Paris this afternoon, and New York by the evening. That makes a huge difference. The climate change has created new habitats. You can see here that the the ambient temperature, the global temperature is increasing, not necessarily to a point that we recognize it every day as humans, we don't feel it, but it changes the world around us. So some of these changes are undeniable, and some of them energize existing habitats. Consider Southwest Asia and Africa this year. The warmer ocean temperatures have supported the truly biblical populate growth of locust swarms, and locusts are consuming agriculture, and entire swaths of the world are dealing with these locusts that have been supported and propagated by slightly warmer ocean temperature in the Indian Ocean and the adjacent seas. And this happens around the world. The Aedes aegypti, a different species of mosquito, was once locally isolated in that part of Africa. It's now global. According to this map, it doesn't quite make France, but actually it may. It's in southern Spain. Aedes aegypti is a vector for chikungunya, for dengue, for yellow fever, and zika. It's traveled around. Consider the growth of dengue. Originally, when first identified in 1943, it was at the very tip of India. Now it has a global presence. In the course of a lifetime, it's all over the world, including in France. So this, chikungunya similarly has grown from different strains that have what was once a tropical disease in warm and moist areas now is in the United States, is across Europe, is in China and in Australia. The climate change facilitates this growth, facilitates this spread. Several years ago, right around the World Cup and the Olympics, Zika was a huge issue. Zika has traveled around the globe in the course of one lifetime. Discovered in Uganda in 1947. You see the progression here through Micronesia, through Polynesia, to Brazil, then to North America. By 2016, Zika had made it to Europe. It traveled around the world and yet made it to Europe. Again, in the course of one person's life. Warmer water produces new weather patterns. We have more and stronger hurricanes, cyclones, and typhoons. We have more and stronger tornadoes, heavier rain, more frequent rainstorms. This has changed the habitat. This has allowed insects to expand their range. This has reduced the number of wetlands that are out there. It creates poor air quality, and it adds added runoff. When the water falls, it needs to go someplace, and it goes into the sea. What difference does that make? Well, we have increased intensity and frequency. Huge storms in the Caribbean and Europe, North America, Africa, Asia. I highlight the U.S. Midwest. Tornadoes are a particularly scary storm. So these storms are happening more and more often. Once in a century storms are now happening every year. As a framework, I highlight the Hurricane Maria in September 2017. And this is clearly not related to Europe, but it's a measure of the size and the intensity of these storms. You can see the island of Puerto Rico outlined there, about almost 14,000 square kilometers, 177.8 wide and 64.8 tall. The hurricane itself was many times the size of Puerto Rico. It's hard to see in the pictures there. Vast flooding, vast destruction from the wind, entire forests with trees totally stripped of leaves, almost look like a moonscape. Truly an example of nature's strength and nature's wrath. So I focused a lot on floods, water everywhere, and the impact of water and the impact of participation, a huge issue. But the opposite is also true. Climate change has changed our precipitation patterns and brought more drought to more areas of the world. This impacts the agricultural cycle. It impacts what people eat. It also impacts what people eat. It has a secondary impact on the rest of the world. When your normal food sources disappear, people turn to other food sources. And in some parts of the world, they turn to more exotic food sources like bushmeat or wild animals. The interaction of humans with wild animals that suddenly become foodstuff has been a source of disease outbreak, one of the sources of Ebola, and in fact, the source of the 2014 West African Ebola outbreak was the interaction of a child with a bat. So, so the drought has it's a dual-edged sword, or a coin with two sides. In one case, we have too much precipitation, more violent, more frequent storms. And in another case, we have storms that don't happen and areas dry up. The excessive runoff, which can follow a drought, if an area is parched and then there's sudden rain, the water runs off because the ground's ability to absorb is diminished. This has caused algal blooms where excess nutrients feed aquatic flora. In the U.S. and North America, we have red tide. It's harmful. It has an impact on animals, impact on skin, impact on your respiratory system. It's also contributed to more mobile and robust pathogens. It's a list of relatively rare but increasingly common diseases, that are quite frightening. Diarrhea, brain-eating amoeba, and flesh-eating bacteria. If that doesn't catch your attention, I'm not quite sure what would. So as climates change, so must we. This is a global phenomenon, and it will continue to impact our weather. For some places, like the Republic of the Maldives, this is an existential threat. The government of the Maldives recognizes that in 50 years, they may not have a government. They may be underwater. For all of us, it will change the types, the numbers, and the acuity of the health problems we see. Healthcare facilities and the people who work with them must be prepared for extreme weather events. And regardless of the cause, whether you believe humans are the primary cause or humans contribute, climate change is here and it's not going away. It has massive, as a great model, a massive impact on human health. Severe weather causes injuries. You can work your way around the chart. Air pollution causes asthma and cardiovascular disease, respiratory disease, water impact. We're truly a part of our environment, and our environment impacts us directly. So what are the clinical implications here? Well, our patient mix will change. The diseases and the long-term, the chronic diseases and the acute conditions we see will be different. We will see more sickness and more death. We will see more patients coming in EMS into our clinics, into our hospitals, particularly among the pediatric, children, among the elderly, and among those with immunocompromise, and a broader immunocompromise, not only HIV/AIDS, but people with organ transplants, people with autoimmune diseases, people having chemotherapy. All of these are groups that we will see more in our clinics and our hospitals and our ambulances. We will have to control vectors, mosquito control. In response to Zika, there was a resumption of mosquito spraying, which out of concern for pesticides, more or less went away. And then it became a hard public health decision. Do we let the disease travel and impact people, or do we spray and run that risk? We'll need to learn how to mitigate mold and how to control the spread of mold, not only post floods, but in houses, in buildings, in industrial buildings. We will clinically need to expand our ability to isolate. Ebola, SARS, MERS, and COVID have all required patients to be segregated from the treatment venue. And we don't know what next. There will be, as we deal with one pandemic, it's assured that there will be another pandemic. When does it come? How severe will it be? We don't know. And as we learned with Ebola, there's increased supply and medical waste requirements, things we need to factor into how we treat. There are multiple non-clinical issues. There are facility implications, environmental design, site preparation. Do we have the right rooms to treat the patients who we're going to see? Is the site safe? I'll talk about that in the next slide. Can we isolate people? As we've placed people, as COVID patients have come into our clinics and hospitals with respiratory distress, we put them on supplemental oxygen or on ventilators. But many older facilities have found that they don't have the volume, they don't have the capacity to pass oxygen through the facility. So even if you have the machines to take care of the patients, you don't have the oxygen available to feed the machines. And then the requirement to do for sterilization and decontamination, that's increased. We have issues of access and equity, and then legal implications as well. Here's a slide from the United States. It's a hospital in Binghamton, New York, that was built along the river. The designers of the hospital realized that the river on occasion might flood. So they built into the design of the physical plant, into the site plan, a flood barrier that prevents the water from penetrating that hospital. They had to rethink how the electric system fed into that facility and project the utilization trends and plan for the unthinkable. Even if they protected the hospital, if patients can't access the hospital because the area is flooded, then the facility is of no use. Well, there's also the practical and how we design our buildings. This is a picture of Memorial Medical Center, which suffered a complete collapse after Hurricane Katrina. The condition inside the building in New Orleans, it was 43 degrees Celsius with 98% humidity inside the building. The staff that was there, isolated, as you can see, by the flood, who were taking care of the patients who were still in the facility, couldn't open the windows because the building was designed with windows that don't open. Eventually, they thought to literally just throw chairs through the windows and break the windows, which exposed the interior of the building to flood water that was fouled, the birds and insects. It was surely a case where the human factors, the design of the building, did not permit the dedicated staff to take care of the patients that they wound up having to serve. We will need to look for the little things. This is a facility in Pennsylvania. And the reason I put this up, this facility at one time in the recent past, suffered an electrical outage. The emergency generators in this facility kicked in and all of the key systems operated, keeping the patients safe. Unfortunately, what you can't quite see in this picture is off to the right. There was a little concrete block building that nobody was quite sure what it was. The electricity went out. The concrete block building was the pumping station for the hospital's septic sewer system. So what happened is, even though this hospital kept running, the ability to discharge waste from the facility into the sewer system disappeared. Needless to say, that caused quite distress and an uncomfortable situation with the hospital. So I push this in the point that even as we think of the major systems and the major issues, sometimes it's the littlest thing that can trip us up and cause us problems. We'll need to be able to address into our internal capabilities, as I talked about, surge capacities. Can we isolate people? Can we increase the volume of medical gases? Can we decontaminate? Can we sterilize? Clearly, COVID-19 has demonstrated some of the deficiencies globally in our healthcare system. And we continue to see the spread of disease both through man's activities, man's behavior, and through the way climate change has fostered this spread. I throw also a matter of equity. Here again, I refer to New Orleans and New Orleans and Hurricane Katrina. You see here a map from the 2000 census that shows the income levels of residents of New Orleans. The lighter shade is lower income. This is the lower Ninth Ward, truly an impoverished area of New Orleans. What's striking is when you look at the area that flooded, the area that flooded is almost a one-to-one direct correlation with the poorest area of the city. Universally, in every nation, even the most advanced nations, the poorest among us, the most disadvantaged among us, suffer disproportionately from disasters when they occur. Hurricane Katrina was arguably a result of climate change, of our inability to build effective countermeasures, and of nature showing us, in my opinion, who's in charge. So in summary, climate change will affect every aspect of response and care. Local and regional resilience is absolutely critical. Clearly, international collaboration and efforts are critical, but few of us have direct impact on that. We do have impact of what happens around us. We will continue to face continuing challenges. We'll need to be able to identify new diseases as they emerge and impact us, hopefully sooner versus later. We will need to have the capacity for syndromic surveillance and early identification. The response community bears a outsized role in that, to be able to identify when patterns of illness, patterns of injury start to change and be able to report that to public health officials. We will need to understand changing requirements. The example of having Ebola waste, the amount of waste, the amount of required medical supplies were different than anything we've seen in the past. We'll need, as a matter of health public policy, to increase general and medical literacy, to fight against the vaccine hesitant population, and to work on access to care and distribution of supplies. Clearly, again, our current situation with COVID is a prime example of that, where the scientific community has performed historic, almost miraculous response based on 20 years of research, but to be able to produce effective vaccines within months, yet the deficiency has been getting those vaccines distributed. All of this factors in and links to climate change and how our world is changing around us. Again, some references for anybody who wants to do further research, and my contact information. As I said in yesterday's session, I thank all of you for your contribution to humanity, for taking care of your fellow citizens. I wish you success and health, and thank you for your attention.